So, as many of you will know, I am an addiction psychiatrist. So what that means is I went to medical school and I trained to be a doctor. I also took some time out of medical school to do an intercalated degree and get a BMSc in neuroscience. Then after working for a couple of years as a junior doctor, I specialised in psychiatry and trained at the Institute of Psychiatry. I became a research fellow at one point as well. And then I developed a real interest in addiction psychiatry specifically. And I contributed to nationally recognised guidelines about the way that we should prescribe medications to support people with alcohol use disorders. With all of that in mind, I felt like it would be a missed opportunity if I didn't talk about how medications can be useful for people that are trying to curb their relationship with alcohol. And I do think actually a lot of doctors just don't think about these medications as often, and they're not prescribed as often as they maybe should be. And there's opportunities missed when they could be helpful or useful. But I want to caveat that with the fact that this is not personalized advice. This is just information that I felt duty bound to share, just because it's knowledge that I have. And one of the things that I always want to be able to do with my own patients and people that I meet in clinic is to share information and to equip people with the knowledge that they need to make the best decisions for themselves in collaboration with their healthcare professionals. I'm going to talk to you about medications that we can use to help curb our relationship with alcohol. There's three main medications that we can use to help somebody to curb their relationship with alcohol or to maintain sobriety. And those three medications that we're going to talk about are naltrexone, acamprosate, and disulfiram. So what is naltrexone? Naltrexone is a opioid receptor antagonist. So what this means is it blocks the endogenous opioid receptors in our brain. And when we're drinking, normally what happens is alcohol, it has an effect on these opioid receptors, which it stimulates them and it creates this kind of pleasurable sensation. So when we use naltrexone to block that, it interrupts that reinforcing, rewarding cycle of drinking where it feels good. And in doing so, it helps to break that cycle of drinking. You can take naltrexone as an oral tablet, and you would be taking this every single day. But there are also options where it's given as an injection. And that means that you don't need to remember to take it every single day. There's pros and cons of the tablet versus the injection. There's some circumstances where we wouldn't want to give somebody naltrexone. So particularly if somebody's taking opiates and they need their opiate receptors to be active. And also if somebody's got severe liver failure as well, or any problems with their liver. But again, I think it's useful to know that these medications exist. And so it's something that you can talk to your doctor about and consider whether naltrexone is the right option for you in terms of helping you to, avoid or reduce binge drinking and reduce how much you're drinking or completely stop altogether. So the next medication I want to talk about is acamprosate. And I thought it might be useful just to understand how acamprosate works. Remember that alcohol is a really potent drug that has a really powerful impact on your brain. It disturbs a key neurotransmitter called glutamate, but also your GABA receptors, which is a really important receptor in your brain that's involved with anxiety, depression, and lots of inhibitory pathways in your brain. So with long-term use of alcohol, this particular receptor and this particular neurotransmitter, glutamate and GABA receptors, their function becomes distorted, and the balance between neurotransmitters and receptors goes all out of whack. So one of the things that can then happen is after you stop drinking, you get this rebound excitation of the GABA receptors. But what acamprosate does, one of the things that it does, is it helps to restore the balance between the glutamate neurotransmitter and also stabilizing the effect on the GABA receptor as well. It's a medication that can be really helpful in the early stages of when people have successfully managed to stop drinking, and helping to address some of the kind of underlying kind of agitation, anxiety that leads to the cravings, which then leads to the drinking behaviors. I guess that's a little bit of background about how acamprosate works. And then next I'm going to tell you about the kind of the practicalities of how people take and use acamprosate. So in terms of the practicalities of how acamprosate is used and administered, one of the key things to know about it, I suppose, is it's a pill and you have to take it 3 times a day. Now, for some people, that's a bit tricky to remember because it's taking medication 3 times a day. It's really effective, and it's a medication that you can use for weeks or months after you have quit drinking, and it does significantly improve your chances of remaining abstinent. Acamprosate is definitely something that I would speak to your GP or psychiatrist about. Let them know if you've got any problems with your kidneys, because we wouldn't want to prescribe it to somebody who's got problems with their kidneys. Ask them about side effects, but it's definitely worthwhile considering as an option to help support your journey to curbing your relationship with alcohol. Now, the final medication that I want to talk about is called disulfiram. Disulfiram is a little bit different from naltrexone and acamprosate because it acts like a deterrent. It acts a bit like a chemical handcuffs, because if you were to drink alcohol on top of taking disulfiram, it would make you feel very physically unwell. And so for a lot of people, knowing that is present, knowing that you have this almost like chemical handcuffs, it acts as a very strong, powerful deterrent. So what I'll do just now is I'll just give you a very brief overview of how that actually works. And then again, just thinking about some of the practicalities of how this medication is used. How does disulfiram actually work? This is maybe too much information, but I think science is really cool and interesting. So, and maybe some of you guys do as well. First of all, think about what happens to alcohol when you ingest it. It's broken down. So we actually end up excreting alcohol out of our body, mainly as water. But there's a couple of chemical processes that need to happen first before we're able to do that. And most of that happens in our liver. And there's a really important enzyme that breaks alcohol down before we can excrete it. And that enzyme is called aldehyde dehydrogenase. But what disulfiram does is it blocks the action of aldehyde dehydrogenase. So that means that we're not able to effectively break down the alcohol and excrete it out of our bodies. And so that results in the accumulation of a toxic chemical called acetaldehyde. What does acetaldehyde do to our bodies when it accumulates? Acetaldehyde is a fairly toxic, unpleasant chemical that we definitely don't want accumulating. When it does accumulate after having consumed alcohol with disulfiram, one of the things that you notice after about kind of even 10 to 20 minutes is facial flushing. And so people can feel really hot and just a bit kind of uncomfortable in their face, but they also start to feel really nauseous and sick. Their blood pressure can become elevated and they can vomit. And they generally feel really, really quite unwell. And this effect can last for an hour or two or even longer. I suppose some of the practical things to know if you were to take this medication is just to remember that there's alcohol in things like mouthwash or in cooking sauces. And so you do need to be very careful with kind of just making sure that you are not ingesting alcohol accidentally when you're taking acetaldehyde. The other thing that I've seen sometimes with patients or heard about through other people's patients as well is people trying to test it. And again, that's something that definitely wouldn't recommend. In terms of the practicality of this medication, it's a tablet that you have to take every single day. And so it actually works best when somebody else gives it to you, because it removes that temptation of the option of just skipping the tablet for the day. So usually if we do prescribe this, and if I was to prescribe this in my clinic, I would prescribe this for somebody that was really committed to change and really committed to absolute abstinence, but wanted a degree of accountability and wanted that extra layer of protection and support from somebody that lives with them that could administer this medication every morning to them. The other thing that I've noticed as well is that this is a medication, it can help restore that relationship, it can help restore that trust. Because if you can imagine the partner of the person who has a history of drinking heavily, they might have all sorts of anxieties or concerns about, are they going to come home from work drunk? Are they going to be safe driving home? I've seen them in the morning, but what kind of state will they be in later on? And, can they pick up the kids from school? And that creates a lot of anxiety for the partner. But if the partner gives the medication, the disulfiram, the kind of almost like chemical handcuffs, it can provide some kind of reassurance for the partner, and it can help to rebuild that trust between the person who's maybe drinking a bit too much and their partner. But it's definitely not a medication for everybody. It's not something that I would prescribe without thinking really carefully and without kind of discussing this in a lot more detail than we are just now. I think people should know about and have the opportunity to then, I guess, expand your knowledge even further and discussing the pros and cons with your doctor to see if this is the right approach for yourself. So just as a recap, I specifically wanted to do this session because I felt like one of the unique things about Curb is that it's built by addiction psychiatrists. It's built by people like me, and also having kind of asked for advice from colleagues and other experts. And so as part of that, one of the unique things about us is that we do have access to the best in class medical knowledge and kind of the latest research and guidelines on how we should be supporting people with curbing their relationship with alcohol. And there's different approaches that we can take in terms of lifestyle approaches, also kind of psychological approaches with talking therapies. But one of the approaches that I thought was just worth acknowledging was medication as an option. And I just want to caveat with the fact that this isn't personal advice. This is just it's generalized information and a bit of an insight into my own personal clinical practice, but this is very much something that you should talk to your doctor about on a one-to-one basis. If nothing else, I hope the science lesson was interesting, and I also hope that I've pronounced all of the enzymes and breakdown products correctly. I'm sure there's somebody out there that will notice I've stuttered and stumbled, but I think we got there in the end.